the next few weeks might be a critical turning point for this country's fight with 3 different viruses. New numbers from the CDC show that early signs that the flu might have peaked, but that's far from a guarantee. And at the same time, COVID infections are seriously climbing. NBC News correspondent Sam Brock has the latest.
It's the most wonderful time of the year to see family, but unfortunately the holidays have also proved fertile ground for transmitting viruses, and many Americans are all too aware.
I'm vaccinated and boosted and even got the flu vaccine.
We try to be safe, try not to see a lot of people during this time so we can actually be with our loved ones.
Those all-important get-togethers are coming at a time when hospitalizations for the flu have fallen for 2 consecutive weeks, though seasonal activity remains high according to the CDC. And COVID infections are beginning to gather steam. Over the last 2 weeks, COVID hospitalizations are up 7% and deaths 15%. The places with the biggest change in hospitalized patients span the map, from Delaware, D.C., and New Hampshire in the east to Louisiana in the south and Wyoming in the west, where the figure has jumped more than 40% in a week. At Miami's largest healthcare system, Jackson Health,
it's essentially quadrupled.
Chief Medical Officer Dr. Hani Atala says there's been a significant uptick in patients just in recent weeks.
We saw COVID was in the teens maybe 3-4 weeks ago. It was relatively low. We saw that number jump up to mid to high 90s about a week ago or so.
And with Americans crisscrossing the country, many fighting weather and coughs, the best option may be to assume those you travel around in the next couple of weeks are sick.
On the return trip home, and also in those first few days going back to school, back to work, what kind of advice do you have for people?
If you're traveling nowadays, make sure you're wearing a mask. Obviously, it's even better if you're wearing a mask and have your vaccine. If you can schedule your travel at times where it's a less busy travel time, which of course is difficult this time of season, that's a good idea as well.
Even now, medical experts say getting a flu shot or a COVID booster could make a big difference.
NBC's Sam Brock with that report. And joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, good morning. Happy holidays. Thanks for being with us. Let's start with COVID. You and I have talked about this a few times in recent weeks. Those numbers really starting to climb. A lot of public health officials say because of so many family gatherings around the holidays and the terribly cold winter weather, keeping people indoors, we're probably going to have a major spike in the next couple of weeks into January. What are you seeing so far?
Jonathan, happy holidays. Great to be here. Just exactly that. We are gearing up for a winter surge that's not going to look as bad as 2020, 2021. That's the expectation. Remember, Jonathan, everybody is testing at home. They're not reporting those numbers. So the estimated infection rate is going to be much higher than what we're actually seeing in terms of reported numbers in media. We're estimating infections to peak at about 1.6 million by the middle of January. We're going to see we expect, these are forecasts, anywhere from 6,000 to 8,000 deaths week over week, mid-January to early February. So the worst is yet to come for COVID, we think. But that's going to be the second half of the cold and flu season. And to your point, flu hospitalizations are at a peak, at a 10-year peak at this point in the flu season, hopefully coming down. RSV similarly coming down. So some good signs, but we're at a really high peak for those 2 viruses.
Yeah, and I want to get your take on potentially a troubling development when it comes to COVID. We're seeing, of course, this massive outbreak right now in China as they ease their zero COVID policy restrictions. What is your degree of concern about the virus, not just spreading from China, but if that's going to be such a hot zone, the chance that we may get a mutation and a new variant that we're all going to have to grapple with?
Well, Jonathan, I think that's exactly that. From a global security lens, the chance that a variant could arise, we're seeing tens of millions of potential estimated infections day over day. That type of transmission, invariably, there will be a variant. Whether that causes vaccines to no longer be effective to keep you away from somebody like me remains to be seen. But the chance of something like that happening is certainly higher given their pivot. I'm more optimistic than some that they're going to escape a severe surge in terms of hospitalizations getting really, really high and people dying at rates of millions and millions. I think I've seen some numbers out there that are very extreme. Remember, 98% of the Chinese population has at least 2 vaccines in them. Those vaccines are not the mRNA vaccines, but they are somewhat protective against severe illness. So I do think they have some level of protection against a severe surge.
Dr. Gupta, Elise here. With so many viruses swirling around, RSV, the flu, COVID, people are suffering the common cold. Can you have more than one of these at the same time alongside COVID?
Elise, that's such an interesting question. Sometimes my patients who, for example, have asthma, COPD, will ask that question because they're medically higher risk. What we've seen is that if your body is fighting off one virus, like, say, flu, it's possible that you could be co-infected, but it hasn't been likely where you're co-infected with COVID and flu at the same time. One of the hypotheses is that your lungs are revved up, your immune cells are revved up in your lungs, and they're able to actually fight off a second virus as they're taking on their primary fight against whatever infected them first. And so that revving up of the immune system appears to be protective against co-infection, two viruses at the same time. It's possible, but it appears less likely.
All right. Well, Dr. Vin Gupta, with these cases so high, I'm certain we will be speaking to you again soon. Thank you for joining us this morning.